Thank you so much. Thank you for doing this. Thank you for carving time out. I know as a fairly new mom, like the time you have for yourself is so limited. So I just want to say, like, genuinely, I appreciate it. Meghan Sak-Ocbina, thank you for being here. Thank you for joining me on the Self-Slagging podcast. Um, for listeners who aren't familiar with who you are, I would love for you to just kind of give those cliff notes, those bullet points. Like, what is it that you do here in the fitness space?
Yeah. Hi. Thank you, Cory, so much for having me on. I love your podcast. So I was very flattered that you asked me to come on. So my name is Megan. As you said, I am a physical therapist and strength and conditioning coach and a new mom. I'm about 8 months postpartum right now. So kind of wearing a lot of different hats, but I primarily work with people remotely. I do work with a couple people in person still, more like concierge PT, but primarily I work with people remotely, both in like a rehab and a performance capacity, and working with kind of all types of clients. But I would say the majority of my clients are women around my age, so like mid 30s, 20s to 40s, and a lot of postpartum or planning to be pregnant or currently pregnant.
Amazing. And I guess like I didn't think I was gonna want to talk about this like immediately or directly off the cuff, but something that I experience a lot of as a coach as well is um really this nervousness and fear that women have either going into childbirth or even beginning that postpartum phase, thinking that they're not going to be able to regain their body composition, that they're subject to postpartum, that physique, and really how that feels. And I guess like in your experience, both as a coach as well as a mom, like, because I know I saw your story just today, or no, it was yesterday. I was talking about like the importance of lifting and how like just how much you need that in this phase, even being 8 months. What has your experience been with that? I guess like with overcoming that narrative, because I'm sure you probably have heard it too from other women, just thinking that they're subject to now just full time being a mom, including their ability to shape and build their physique.
Yeah. Oh my gosh. I mean, there's so many different layers to it, right? Because I think, I mean, as a new mom, I mean, it's not like I didn't expect for it to be hard. Obviously, I didn't think it was going to be easy. But I mean, you're exhausted. Sometimes you have a FOMO baby that doesn't let you do anything, or you don't have the kind of support or resources to train the way that you want to. But I think there are a lot of different ways to see results. I mean, it's a season that unfortunately isn't necessarily going to be your most optimal physique building season, but that's why you put in the work before. But in my experience, I mean, this is both as like my own personal experience now, but also that of my clients, is being very intentional before you get pregnant. If you're planning on getting pregnant, on being healthy hormonally, healthy enough to get pregnant, because as we both know, like you can't get pregnant if you're not hormonally healthy. But working on like building as much muscle as you can. And then during pregnancy, everyone's pregnancy is very different. I was very fortunate to have, I was morning sickness. I had that, but it was relatively mild. At least it felt like it was to me. But some of the, orthopedic pains that you can have can be really challenging, and not everyone knows how to modify things. But just finding ways to continue to move, whatever that looks like. And if you are able to keep training hard throughout your pregnancy, it's perfectly safe. There's, certain things that you need to look out for, but it's really just like when you're not pregnant, it's just that consistency. If you're sending that consistent signal to build or maintain muscle. I mean, I gained a lot of weight in pregnancy. A lot of it was water, obviously, and baby and fat. But I feel like I was almost able to like build some muscle. And we could talk about like what happens to your glutes postpartum, because that is like a whole nother situation that I was so, I don't know, naive, thinking I was going to avoid it completely, but it is a real thing. Like the flatness of your glutes postpartum, at least like acutely it is. But yeah, that's been my experience. It was a little bit of a tangent, sorry.
No, oh my gosh, girl, you've listened to this podcast. These are like monologue by monologue. We're just tossing it back and forth. Like, I don't know. People say they like it, so we're just doing it that way. It's super insightful. And I mean, like, I really like my sister has three babies, three kids through IVF, and I've been fortunate enough to see her go through that. And with that, I know like if you haven't gone through it yourself, like I feel very confident in saying like you can't really empathize and put yourself truly in someone's shoes, in what that feels like. And especially for women, I know a lot of listeners, a lot of clients I've worked with, they really like, they really struggle with that identity loss, particularly if there's someone that's spent a lot of their life building their physique, and not even necessarily for competition or, for a competitor, for a sport in itself, just like knowing that that's something that like it really is a huge part of their identity, like having to put that on the back burner, or at least for the time being, know that like I'm not going to be able to give everything to it. Although I've been in that position, I can certainly empathize in my own experiences of like now, and I at the time this comes out, I mean, like we'll be maybe end of the year or early 2026, like with Jordan's new job, like we've traveled 13 times in the last 13 weeks. Like it is, we've moved apartments, like we've been in situations where, I mean, like from a bodybuilding standpoint, it's less than ideal, like even knowing what I know. And I have had to like accept, okay, like, this is our decision. This is something that like we're committed to doing. I'm committed to supporting him. And because of that, it's like, things will look a little bit differently for the time being, but there's a reason. It's not out of sheer laziness. It's not because anything else, then like we've shifted that priority. And like that's probably as close as I can like really relate to, to what someone is going through when they do have to put those physique goals at least on the back burner, and even more so they have to consider hormonally that health span. Like what are they doing, what decisions are they making relative to body fat, body composition, that is conducive with healthy pregnancy outcomes, but also a healthy postpartum phase.
Totally. Yeah. Well, and it's such a shame because there's such a pressure to, bounce back, which like anyone who already follows me knows that I hate that term. Like I just hate it so much. Because I think we forget that we literally just grew a human being. We're going to be a little bit depleted. It's like, it's not at all the same as prep, but it's like, after you compete, your body's not usually in like a super optimal place, healthy physiologically, and you need to help repair that with recovery and food and all that kind of stuff. And, sleeping isn't necessarily something that you can really control postpartum. I will say that firsthand. But nutrition wise, if you have the means and the education, like I would highly encourage people not to try to diet postpartum. Like I've been very intentional. I mean, I struggled with it too. I was like, you don't want to I felt like a flabby burlap sack immediately postpartum, essentially is how I felt. And you don't feel very good in your own skin. But you have to play the long game. You have to consider like how much your body just went through. And then also if you are like breastfeeding, like you really have to consider extra calories for that. Like it is actually very calorically, a lot of expenditure through breastfeeding. So considering that if you're training and just really trying to focus on replenishing yourself rather than just like rushing into like losing all the baby weight. Because just anecdotally, and I'm sure there's a very, very like genetic component of this, or, my situation's obviously very different from other people's, but I've been very intentional about not trying really hard to diet postpartum. I've been trying to eat, mostly whole foods, some processed foods because I'm trying to eat a lot of calories and it's a lot easier to eat high calorie with some processed foods. Because I was breastfeeding and I was training and I'm a pretty active person in general. So I didn't want to lose weight too fast because I knew it was probably going to be a lot of muscle as well as body fat if it was like happening that rapidly. And then just focusing on like restoring my strength as much as I could and just putting that as my focus instead. Because again, like I said, it can be really uncomfortable to feel like not like you're essentially feel like a fractionated version of yourself because this little human needs everything from you. And obviously, you want to be taking care of this baby, but it's really hard to get that self-care in. And when you're also trying really hard to like shrink yourself in a not so healthy way, then that can just kind of add to that negative mindset, at least in my opinion.
Gosh, there's so many amazing gems you made just there. I mean, I imagine that in that state, I mean, there is a lot of internal conflict because it's like if you have only white knuckled your way previously into that low body fat, that leanest physique, you're probably going to have to confront it at this point, which is also a point in which your priorities are very much shifted. And in I think a lot of new moms cases, like for the first time, your needs are gonna have to come second. Like, I mean, like that was the responsibility that you agreed to when you had a baby, is like there's gonna be a long period where, you very much should take care of yourself, but you're going to forego self-care in I guess really the attempt to make sure that you're providing the best care to your newborn. And I think I imagine for a lot of women, like that identity crisis is so hard. In addition to what's expected, just hormonally, the shifts of, actually giving birth and then going into that postpartum phase. So, I mean, I love that you touched on too, um, building strength back, and this is something I'm sure we have a lot of overlap in, where women expect that, okay, I took, in my case, I took a week off. I went to my partner's family's for a week and I didn't work out, or I went to Europe, I was on vacation, so now everything feels so much harder. I think I lost muscle, my glutes are flatter. And I think a big part of like how I tried to teach muscle loss versus strength loss is disproving that, is also setting expectations that, like, hey, like that strength in itself, like it didn't completely go away, but like if you were doing, let's say, B stance RDLs 3 times a week and like working at a really high intensity, not doing them for even just a week, like you're going to feel that for a few sessions. And that's like very much short term acute adaptations. Whereas in the case of someone who, let's say, had a more complicated pregnancy, maybe they were instructed, maybe they, against their preference, like they had to take more time off training and keeping these things up. So I want to go back to what you said about the glute transformation that really messed you up, like shocked you. Tell me a little bit more about that.
Yeah, so I mean, I don't know if you've heard or your listeners have heard people talk about like quote unquote mom butt, which is, it's not really my favorite term, but it is a very common thing, is like that kind of like flat, almost like a frog, a frog butt type situation, clenched glutes. And that's actually not really what I was experiencing, but postpartum, I mean, so if you have a vaginal delivery, your pelvic floor has just stretched a lot. Your pelvis has had to change a lot, and you do have a lot of laxity, especially, during pregnancy, but also postpartum with breastfeeding. So essentially, I don't know all the reasons why it happens, but so I'll back up just a little bit. I had some complications in my pregnancy. I ended up with gestational hypertension and then preeclampsia at the very end. And so I had to be induced. And then I had to be on magnesium sulfate to prevent myself from having a seizure. So I was in the hospital for 2 days afterwards, basically just sitting on my butt for 2 days after delivering vaginally. And so what I think it probably happened was, obviously your muscles are depleted from not using them for a couple of days. But then also, your pelvic floor is kind of like, it's what has just happened to me, right? It's wounded essentially. And with that can come a lot of guarding, and essentially all that happens with all of that is going to come along, like your muscles just don't look as full. They don't work as well. Like hinging, I couldn't hinge for like, I don't know, probably at least a week postpartum. Like I could like very shallow hinge, but it was wild. It was very humbling because I'm someone that very much understands my body. I lifted until the day before I went to the hospital for my induction. Like I was very pretty much maintained a lot of strength even with my complications. And afterwards I was just like, it's karma for feeling like I was going to escape this essentially. But so that's like acutely postpartum. That's like what people all talk about, is like, oh my God, my butt disappeared. And then some people never get it back because they don't actually they don't realize like how many compensations you have with the morphological changes that happen during pregnancy. Like your hip rotation changes, your center of mass changes, your thoracic and lumbar extension changes. So all those things, if you're not aware of it and you're not like actively working to restore the normalcy postpartum, they kind of just stay, and then it affects you like for the rest of your life. And that's like stuff more I see as a PT, because I work with people who have issues based on all of those changes that they never really addressed. Because I think a lot of people don't realize like it takes work. It's almost like an injury that you have to rehab from.
Okay, this is such a I love how we're gonna how I'm imagining we're gonna parallel this, and I'll do my best. But for moms listening, please forgive me because this is not my forte. Um, a lot of what I see though is with competitors who believe like they have stubborn glutes, they have a lack of activation. And I know for myself, like I had one glute that was very much non-dominant, underdeveloped. Like no matter how lean I got, like I would see like that lack of glute max. Like there just wasn't that chunk and depth to it as opposed to my other one. And it wasn't until I started working with my boyfriend Jordan Genta where he actually went through and he's like, you have a hip that likes to be in one aspect of the range of motion, and then you have a hip that doesn't like to be there. And we just need to bridge that gap. We need to find a point in which we can decrease the asymmetry. And after actually training that hip rotation, hip stability within these non-preferred parts of the range of motion, I was able to see like, okay, this makes complete sense. And without his help, without his education around this, I would have continued to just hammer away at that same hole, at the same exercises, and just, I really was at a point where I was like, I think I'm probably just gonna have to take drugs to get more glutes because at this point, like, I don't know what I can do to get my left glute to really develop. Like maybe I've just maxed out that natural potential. But I mean, I see this in my experience with a lot of individuals who they normalize the positions that they're in, and it maybe is through repetition of just finding these positions because that's where your body wants to go. Your body's trying to keep you safe. It's trying to find a position that feels most comfortable in. And the way I explain it, particularly with unilateral hinge work, I'm like, your body is going to put you in the position, and I guess not just hinge work, any unilateral hip work, is your body's going to put you in the position that it knows how to tolerate. It's not going to lead you to the position that feels uncomfortable. And that's where we see the excessive shakiness. That's where we see these compensations. So essentially, we just have to find those compensations and know there's a reason our body doesn't want to be in that position, but it's probably exactly what we need. And it's kind of like, I don't know, it's kind of poetic in a way, like where we see our physiology really lead us. But I I guess I'm interested. I want to I guess in your experience, have you seen that traumatic response, even acutely for individuals who, let's say, have had an IUD inserted, maybe the first one, second one, where there is that guarding, there is that repetitive contraction that happens just from simply the tissue being so disrupted and your body being quite literally traumatized by the experience?
Yeah, I mean, I actually can think of one client, which one out of many, that did have essentially like a pelvic floor. Her pelvic floor was guarding after her IUD was inserted. It took us a while to kind of come to that conclusion, but we did kind of figure out that she was having some hypertonicity of her pelvic floor. So her pelvic floor was excessively tight, which we could talk about like why that can limit your hip mobility, can limit your ability to get into like that hinge position. So your ability to load your glutes, for example. But yeah, and she ended up getting it removed eventually, and things slowly got better. It wasn't like an instantaneous thing. And I do think sometimes if you're like people tend to have tighter pelvic floors for many different reasons. A lot of the time, if you're higher stress or if you've had trauma or if maybe you were taught to tighten your pelvic floor or you are gripping your abs all the time, which I'm sure is very common in bodybuilding. And or wearing a waist trainer, things like that. All that stuff does affect like the pressure on your pelvic floor, and your pelvic floor responds to that pressure. And that will affect your training performance 100%. It's just something that we don't really think of initially. Like most people don't even know where their pelvic floor is, or they don't think they really need to think about it unless they're peeing all over the place when they train or when they're sneezing or whatever, or if they're pregnant. But everybody has a pelvic floor, and it definitely, I mean, it's part of the core, just like the diaphragm in your thorax is part of the core. We think about like the abs as the core, but it's really this like, it's a canister. That's why the pelvis and rib cage position is so important, because lining up those two diaphragms, your thoracic diaphragm and your pelvic floor, your pelvic diaphragm is another word for it. That really helps with the entire pressurization of that system. And if something is like super tight, or you can even have one side that's tighter than the other, like with your hip asymmetry, which I mean, we're all asymmetrical, and I would say pregnancy definitely amplified all of my asymmetries, 100%. If you have a side that you like to pose on more than the other, there's usually a reason why you like to, but also you're just going to hammer that asymmetry even more. But yeah, I mean, I wouldn't say like every person who has an IUD should expect to have pelvic floor dysfunction. Definitely am not saying that. But if you are having symptoms of some pelvic floor dysfunction, it might be something to look into.
And I guess that maybe I should have prefaced that I've had my second IUD. I had it inserted in May, and I mean the actual, I don't know, healing process, it was pretty lengthy for me. And the first one that I had, I mean, it was pretty short lived. I mean, sure, it was painful for someone who hasn't had a contraction. You're okay, that'll wake you up. But the second one that I had put in, I mean, like the cramps were so bad, like, and not just for like not just obviously like when it was inserted, I mean that was painful, but then like following, it very much felt like it felt very traumatic to the point that like even like when I was trying to train, like I could not, like I was like I'm gonna vomit. I'm in so much pain. Eventually it did go away, but at the same time, I mean, I guess this is probably a better approach to attack this for listeners who may not know if their pelvic floor is tight. How would we go about this assessment? What do symptoms look like?
Yeah, that's a really great question. So a few symptoms. So there are symptoms of your pelvic floor being dysfunctional, whether that's too loose, so too weak, which is probably not many of your listeners, too tight. You can also be tight and weak, just like a hip flexor can be tight and weak. And then like your coordination is just off, which I would say with like higher level athletes, that's probably the most common one. But some symptoms of the dysfunction would be obvious ones like def- um, incontinence. So whether that's urine, feces, or even like flatulence when you don't plan on having it. So like when you're lifting or sneezing, things like that. Difficulty with going to the bathroom, so constipation or like not being able to fully empty your bladder, or feeling urgency, like you have to go to the bathroom, but then like nothing is really there. Um, pain with intercourse or pain with insertion of a tampon. I would imagine, and I have never had an IUD, so I don't really know what that experience. I have had contractions, but not an IUD. I would imagine that is probably always painful, so I wouldn't like really put that into the realm of necessarily assuming that your pelvic floor was tight. And then also limited hip mobility. And then sometimes people, if you have a hard time, um, like if you have like a lower belly pooch, but it's not fat, like if you're really lean, but you have like a significant lower belly pooch. I mean, we all are going to have a little bit more down below versus up top, especially like as the day goes on, as we eat. It's just normal female anatomy. But if it's like significant, then that can be kind of a proxy for pelvic floor dysfunction because your whole core canister is dysfunctional. So your pressure management strategies are not optimal. And I've seen that anecdotally with people who have used waist trainers in the past, just because they just, I mean, I'm sure there's some utility for them as long as you understand the risk. It's like everything on your podcast, as long as you are informed of the risks of using them and that they are probably not necessary, then it's fine. It's not like bodybuilding is a super healthy sport or any high level sport is healthy. But I think understanding that there are other ways to go about like waist control. Uh, but yeah, I think that's oh, neck pain, jaw pain, rigid feet. Like there's all sorts of things that can come along with pelvic floor dysfunction, not necessarily always an indicator, but the patterns that I see clinically and then just experience as a coach, people that grip their glutes all the time, a lot of time that's because they're gripping for stability and you're not able to actually get it through the whole system, so you're just looking for it somewhere. But yeah, those are a few things that could be going on as far as pelvic floor dysfunction goes.
No, I love that. And I can already start to hear some of the questions I'm going to get from my clients about this, because I think what's going to end up happening is people will reverse engineer it and be like, well, okay, could I be getting more progress, or could my stomach potentially look better and smaller if I worked on my pelvic stability, or in this case, pelvic floor stability? I I guess I want to go back to the incontinence and then the painful intercourse, because I think those are some things that there's a lot of overlap when it comes to the states that we are in energy deficits, whether that be fat loss or prep. But you see a downregulation of hormones. You see that there are going to be things that physiologically drive libido and then sexual performance down, which I think can then exacerbate pelvic floor tightness. Now, when we're talking about incontinence, because I think that's something also that a lot of people they fall on that side of like just not having regularity there. So yeah, I guess, and I don't really know how deep I guess I want to go into this, but someone who is suspicious essentially of these symptoms, not really knowing, okay, maybe they're not daily symptoms, but they're certainly experiencing maybe a hint of these symptoms infrequently or at intervals, particularly when they're under stress. What would evaluation, they come to you, and I guess like what's the inventory, what's the index that we go through to assess, okay, like is there, more of a litmus test that we can do, putting someone in positions that can give us the green light that, hey, this might be it. It might not be the full picture, but it's definitely playing a role. What does that assessment look like?
Yeah, so looking at patterns for sure with either of those symptoms, because like I said, you can actually have leaking when you have a pelvic floor that is too tight, mostly because your pelvic floor, just like any other muscle, it has to like lengthen, the eccentric. Just like the glutes have to lengthen. You can't just squeeze them all the time and they're going to grow. And it's not like you're trying to grow a ton of pelvic floor muscles, but develop them to be coordinated with the rest of your core. So if you're holding it tight all the time, that can give you symptoms. But looking at patterns, so like, is it cyclical? Does it seem to be worse like around ovulation or around your period? That's generally the two times that people tend to notice cyclical changes, if they do like within their own cycle. And then also like behavioral things. So like if you, I don't know, if you had like low fiber and you're constipated, or you traveled and you're constipated, sometimes that it can, pelvic floor tension can cause constipation, but it can also be caused by constipation. So like if you are, feeling like you can't fully empty your bowels, that could even be, it doesn't even necessarily need to be like an internal exam assessment. That is probably the goal. It is the gold standard for like knowing for sure from like a clinical standpoint, but there's a lot of things that can help you understand like maybe something is going awry here. Is just like modifying your diet and seeing if it gets better. And then also things like pre-workout or other bladder irritants, caffeine, fizzy drinks, alcohol, all those things can contribute. If you're having like a new pre-workout and it's way more caffeine than you're used to, and you notice in those workouts you tend to like leak a little bit, like it could actually be just the fact that you're having 400 milligrams of caffeine before your workout, and you're not necessarily, your body doesn't really want to have that, and that's a bladder irritant, which can cause the incontinence. And then anecdotally, again, like I was saying with someone, so Tate, one of your athletes, she posted a question box in her story. It was like a couple of years ago, and it was someone that had asked, she said that she had had basically painful intercourse when she was in prep, and she didn't understand why. And of course we don't really know why. I didn't assess her or anything like that, but like experience wise, like with my clients, if your pelvic floor is tight, that's what's going to cause pain with intercourse, because those muscles are in spasm and they have to be able to relax in order for intercourse to happen. So when you're in prep, you're in a caloric deficit, you're probably more stressed, your muscle, you might have some muscle atrophy, which can cause like extra tension, believe it or not, but also just like dysfunction down there. So your body's like trying to compensate. Um, and then just like in general, just holding more muscular tension everywhere, being in a more sympathetic state makes it a lot harder for you to relax, which is again necessary for intercourse. So um that's, I mean, I don't know. I wish I could have talked to that person and delved in a little bit deeper, but I would be so curious as to whether in bodybuilding, like especially like during prep, when hormones are all awry and training performance, you're just fighting for it not to go downhill, whether or not there's like an increase in pelvic floor problems.
I I think that's a really good point. It's something I haven't necessarily dove into in like a solo podcast, honestly, because the internet is creepy and I feel like it would land weird for dudes. But particularly on Patreon, I've gone into maybe some of the realms in which we would troubleshoot hypoactive sexual disorder. And I think it was the Glute Health guys. They kind of broke this down in a way that I really appreciated for women that they were helping and providing service to. But essentially, it can be, I mean, as simple as a three-pronged approach, but we kind of have to figure out where the dysfunction is coming from. So is it structural? Is it perfusion? Which I guess like we can kind of theorize, like in the case that you're experiencing excessive pelvic floor tightness, that would be an issue, even not just with arousal, but also lubrication, I imagine, right? So past that, switching from the sympathetic to parasympathetic, which is something I see very common, like with my clientele, both in prep or just in fat loss phases, or when we're trying to break through that ceiling, really to get into um, body fat levels or new scale weights that for them they're like I haven't really been here before. So it is a bit of a push. It's hard. It's not something that innately I just know how to do. And in that case, it's like, okay, well, we can expect libido to go down. We can expect these physiological changes to happen. And it doesn't necessarily mean we have to react to them, but we need to know when we're kind of this with all of those adaptations that occur. We need to know when we're going from yellow to orange to red. And we ideally need to catch it somewhere in the orange, if not in the yellow. We need to start being proactive there. Otherwise, you're going to be in a position where, again, I'm theorizing. So, listeners, give me a break. It could be something that, does lead to further trauma and further dysfunction and, personally, a lot of frustration, I think, for women then to feel as if like there is truly a dysfunction in their own bodies. And that's why they're not either able to achieve orgasm or sustain arousal in the way that they desire to. Um, I'm blanking on, I said it was a three-pronged approach, and I'm forgetting the third one, which is great. Glad I led that way. Uh, you know it, feel free. Um,
I do not, but I would say yes, that is the biggest issue with like having pain with intercourse is because then you anticipate it. And like I don't know if you've had anyone come on here about talking about pain science. I mean, maybe Jordan's talked to you about it a little bit, but like it's very much an output of our brain. Like our brain decides if it doesn't feel safe in a position or in like in a certain scenario. And so when you can create more pain when you don't feel safe. And so if you already have had pain and you don't know why, then even when you're not in prep, you might still continue to have those types of symptoms, even though your hormones have regulated and you are eating enough and you're not training, like your training stress isn't as relatively high because you're actually recovering. Um, so yeah, I don't know what the third prong is, but that was
yeah,
just my thoughts as you were talking.
it'll come back to me, hopefully, or not, or they'll have to listen to part two. But I do see a lot of the struggle for most women to be switching from sympathetic to parasympathetic, like not even being able to put themselves in the mood to become aroused, or even in this case, like to physically relax their bodies. So then it's just, I mean, like if there was a Viagra or Cialis for women, like I would be all about that. I would very much be supportive of like, hey, let's bridge that gap so then there isn't that performance anxiety, because I think, in that case, like it does typically make things worse, particularly if in the case of a fat loss phase or prep, you're pursuing this goal, you're trying to do something that, is going to offset and bring you value, yet it's coming at this cost. That collateral is personal, very personal, and then can be lingering, particularly if you don't understand it. So I'm so glad we're having this discussion. It's funny. Like I wanted to bring you on here. I was like, I love her training videos. I love how she explains things. I love her knowledge base and how she debunks just a girl. Like if you knew how many times I was like watching people on Instagram and I'm like, why are you holding a dumbbell ipsilaterally and saying that this is going to grow your glutes and minimize adductor, like what are we doing anyways? uh I'm glad the podcast has kind of gone this direction, and that's where, I think a lot of listeners that are going to find the value in, um just even being exposed to this idea that like, hey, there might be a reasonable explanation for the symptoms they're having, or symptoms that in the past they've, kind of downplayed or in a lot of ways normalized. So I guess going back to the assessment, let's say we have a suspicion, right? Like we don't do an actual pelvic exam, but we have a suspicion, someone's working with you and you say like, okay, we're going to try to treat this, find improvement. What does that actual prognosis look like?
Yeah, so without an internal exam, I will have people do like a self-assessment. There are proxies for assessing pelvic floor tension. Like I'll have someone like sit on like a it's not a lacrosse ball. It's like harder than a lacrosse ball, but softer than or sorry, it's softer than a lacrosse ball, but like harder than like a tennis ball. And like kind of put it just on the inside of like the sit bone and then just sit on it and see if it feels different side to side. If it's like crazy uncomfortable, then it could be an indication that you have like a knot in that muscle. So your pelvic floor is tight. You're touching like basically the back of the pelvic floor. Um, and then another thing that you can pay attention to on your own body is I look at how people breathe. Like, are they able to get like 360-degree expansion of the rib cage? Because what happens up on the rib cage and like your ability to even rotate the rib cage, believe it or not, it very much is a story of like what could be going on with your pelvic floor. If you have limited thoracic rotation, a lot of time you have limited like pelvic floor function just because your ability to rotate your thoracic spine will it influences your ability to breathe and expand your ribs in all directions, which affects how well the pelvic floor can respond to that pressure up above. So like people that are like really shallow breathing, which or maybe you're in fight or flight all the time, or maybe they've been told to belly breathe, and so they're like trying to like keep everything else relaxed and just like push their belly out. Or they're like, I really just like a chest breather. Like, I mean, as you have to breathe on stage, you have to like try not to let your belly expand at all. But again, there's a time and a place. You got to just kind of try to counter all of that with restorative work afterwards. But what I'll also have people do is you can sit on like a pillow or like a Pilates ball, like one of those like kind of it's like a soft, tiny little stability ball type thing, and just sit on top of it. And then if you take a breath in, you should be able to feel your pelvic floor, kind of like the space between your sit bones, like change. When you inhale, your pelvic floor should descend downwards. It should eccentrically lengthen just a little bit. It shouldn't be bulging downwards. That's actually something that we don't want. But you should be able to feel a difference between when you inhale and then when you exhale. You don't need to do a Kegel or a contraction when you exhale, but your pelvic floor will rebound up because your diaphragm is moving up. And so your pelvic floor is going to have, it's basically just going to mirror what the diaphragm is doing. But those are things that someone can do on their own. Like that's what I'll have like a remote client do just to see like, oh, is this a factor with like all the symptoms that you're feeling? Is this actually what's going on? And then from there, working on that like nervous system down regulation, modifications in their diet or like their habits if they have them. And then just working on their breathing mechanics and their core recruitment, and then like looking at their training mechanics as well. But those are the things that I'll generally start with. And I'm actually have been very surprised. I've started just screening all of my clients in their intake for pelvic floor dysfunction just because I find it really common. Even if they don't come to me with like any inkling of understanding that they have pelvic floor involvement, a lot of the time with other issues that they're having, it is actually a factor, or it's just something that they've never felt comfortable talking about because we don't really know what's normal because no one talks about poop and no one talks about sex and no one talks about any of this stuff because it's uncomfortable. And it's like, I don't want to be the weirdo that talks about these things, but nothing is TMI for a PT, especially a pelvic floor PT.
Really, the assessment process that you outlined, I mean, I think for a lot of people, they assume that this is something that, as far as treating, having, I guess, going about managing, is largely going to be working with specialists and having them do some kind of soft tissue I don't know, manipulation, soft tissue work. Whereas, like, what I'm picking up on that you're describing is very much that, like, this largely is a muscle that there needs to be an awareness around how to maneuver. Am I describing that okay?
Yeah, yeah. And I mean, there are definitely scenarios when seeing someone in person and having them do manual work is very helpful slash I would say necessary in some cases, but I mean, you can do a ton without it. But yeah, I think just becoming aware of whether or not it's tight or whether or not your coordination is the issue, because that is also, I would say that's way more common for like higher level people that are strong, but they're just not coordinated. So like, for example, maybe you're holding tension in your pelvic floor all the time when you're doing things, but you actually, again, like every other muscle, like if you think about going into a squat, or let's talk about deadlift. If you're hinging, if you're doing an RDL, your posterior pelvic floor actually has to let go of your tailbone a little bit because it attaches there in order for your tailbone to what's called nutate. So kind of tip forward relative to your nominate bone, so relative to your pelvis. And that allows you to actually get into that like deep hinge and into those glutes and like actually lengthen your posterior chain. If you're gripping your pelvic floor, whether that's like doing it on purpose or like just not really understanding that, then it gets really hard to hinge. And so like from a training performance standpoint, that's definitely relevant. But looking, if you're like from like a coach's eye, if you're looking at someone and they're unable to like really get back into their hip, or like say they lack internal rotation, if they're like doing a single leg deadlift or like a Bulgarian or something like that, it's not like I'm always assuming the pelvic floor is the culprit, but sometimes it is another layer and something to just like have the person be aware of, because maybe they weren't before and there might be other things that come up that like weren't really discussed before.
Okay, so I think that's a really good segue into being in a gym session or a training session where you're kind of assessing like, okay, should I be gripping? Should I be releasing in a hinge? So we're starting, from the top, rib cage stacked over the pelvis as your hips are pushing back. What I guess what would be the cues that you would walk a client through that would set them up for success here?
Yeah, so as a disclaimer, I generally will not cue the pelvic floor unless there's an issue, just because it's just one more thing for people to think about and then they like overthink it. But what you don't want to do is like aggressively Kegel at the top of any movement. Your pelvic floor and your transverse abdominis, so that like deep core set core muscle, they're actually like neurologically linked in our brain for a reason, because if they weren't, every time we sneezed or coughed, we would pee everywhere, right? So you want that pelvic floor to respond to that increased pressure above. So naturally, when you're bracing your core, what should happen is your pelvic floor should hold just like enough tension, but not so much that you're not able to like actually get your hips back, right? So sometimes if someone is, say, example, people don't tend to have issues leaking with RDLs, at least in my experience. But like a power lifter, like doing like a conventional deadlift or a sumo deadlift or like a back squat or something like that, the leak doesn't happen at the top. It usually happens at the bottom, for a squat. And that's oftentimes if someone is strong and it's not just like a weakness thing, it's because they're like either their pressure of their core, so like their abs, is too strong for the pelvic floor to handle, especially like as you change direction and that weight is momentarily heavier. Or they're like aggressively kegeling at the top, and then when you get to the bottom, it's like your pelvic floor is kind of tired and done, and then you end up getting that leaking. So what I'll do in that case, so say someone is having issues, if someone is unable to hinge, it's usually because their pelvic floor is too tight, in which case I'll work on like being aware of like letting your sit bones spread apart. I tell people like spread your cheeks when you're hinging. That's like what I cue them to do. I don't know if you've ever used that cue or thought of it. But it usually clicks. Sometimes people just look at me like I'm insane. But it usually makes sense to people and we're like, oh, it feels different. I feel my glutes. Like amazing. Uh,
Professionally, for you, I feel like it's okay
yeah.
if you say that. I will cue myself that way, and that's something
Okay,
I
yes.
very much have to think about. Like, I almost think of just like stretching the fascia. I'm
Mhm.
very hesitant, for legality purposes to cue a client that
Yeah.
way.
Yeah.
But I definitely can understand like how like just making someone aware of like, okay, are we creating horizontal hip translation, and is
Mhm.
there unintentional guarding that's happening when you're trying to
Mhm.
lengthen, because that
Mhm.
very much is like the overthought, I guess overthinking process that happens with a lot of clients is they're focusing on honestly too many cues, so
Mhm.
that by the time we get into that lengthened position, it's like you're so stressed because you're thinking about all of the positions you should be and shouldn't be, that
Yeah.
then you are a little bit rigid. So I can definitely see what you're saying and like how this is something that like I want to say for listeners, and I love that you said it, is like do not take these and like blindly implement them if they're not needed, because you could
Mhm.
be skewing and you could then create issues that you don't have. So
Yeah. Yeah, I would just say, like, if you struggle with a hinge, like, if you struggle to feel your glutes in that lengthened position, a cue that I like is, instead of spread your cheeks, you could say, like, spread your sit bones. Like, imagine your sit bones spreading apart, which they're not actually, like, spreading apart, maybe a tiny bit, but, that can be helpful because it's really hard for that to happen and for you to be, like, gripping your pelvic floor. So that would be, like, something to work on. But also, like, if you have someone do a unilateral movement, again, it's very helpful to see, like, does someone have the ability to get into that closed chain internal rotation with like a Bulgarian, or like like a single leg RDL or B stance RDL, because if they can't, then a lot of time it's because that posterior hip is just like super tight for whatever reason. So being able to like work on their breathing mechanics, and like I said before, like your pelvic floor, generally it's supposed to respond. It's not supposed to like generate a lot of movement or force. It's kind of just like the bottom, and it's supposed to be able to handle whatever is happening up above. But if it's having a hard time doing that because up above is the dysfunctional, then that can also cause problems. So looking at like the whole system is also really helpful. So like getting someone to like get a good stack and being able to breathe while they brace, that's also extremely helpful without even talking about the pelvic floor. And they might end up telling you later, like, oh my gosh, so I used to have this issue and now I don't. I don't understand why. It's just because you help the core function better as a whole.
I think that's a great segue into the breathing component, because this is something Jordan so delicately navigated when we first started dating. Because my biggest complaint was tightness at the scalings, a lot of trap tightness, a lot of just like sitting and living up here. And he brought it up. He's like, like, and this is, it's interesting because it is such a touchy subject, because when you use the term mouth breathing, I'm gonna already mess that up. When you use the term mouth breathing, people immediately retract and they're like, no, that's not me. Like, I'm not a mouth breather. Like, yeah, no, like that was me for a long time, is not really having that awareness of like, how am I getting oxygen into my body? Now I'll say one of my nasal passages is like almost completely closed. So that's not helping anything. Like, I should definitely get that fixed, but that in itself is even more reason to make sure that I'm inspiring and releasing air correctly. Only because that was something like, and I'm explaining this kind of in a very clunky way, but Jordan brought up, he's like, you are so used to getting into that vacuumed position, that stage, that like ultra sucked in position. He's like, I think in his experience, he's like, I get a lot of these same symptoms with people who breathe through their chest, who they have a lot of that same tightness that you're experiencing, you're showcasing. Once we start actually going through the awareness of like, hey, this is what it's supposed to look like when you breathe in, like not necessarily in exercise, but just day to day. This is just how you're supposed to breathe as a human. It made so at first, like I was like, how am I supposed to change how I'm breathing? I've breathed this way my entire life. But it was a huge game changer in the amount of tension that I was storing, specifically front of the neck, traps right at the collarbone. But I cued that. I've walked a few clients through that who are reporting those same symptoms, and it's like a light bulb goes off. They're like, no, I get it now. Like, it's so much harder to breathe in through my nose and like really focus on actually keeping the ribs depressed, in a way that isn't just like constantly just having me kind of live in that shoulder to ear position at the day.
Yeah. Well, and just like any sport, like if you want to have longevity in it, you need to find ways to sustainably counter the positions that you have to have in order to perform. So, like, for example, on stage, waist control is necessary. You want your chest to be proud. You want to be able to keep your ribs down, but like get your abs tight. So, like, if you're practicing vacuums or like just transverse abdominis work, you want to also make sure that you're like still able to maintain that like 360 breath without like just holding so much tension, or like having to crunch down in order to like expand back, or having to lift your chest up, or like breathing like you said through your neck. And mouth breathing is something that I think a lot of us do, just like I was sick a couple weeks ago, and so my nose was runny for like literally like 2 weeks. It was super annoying. And I found myself just breathing. I was like, why are my lips so chapped? This is so crazy. And it was because I was breathing through my mouth and I didn't even like realize it. And it just, I mean, like nitric, we don't have to talk about like nitric oxide or any of that kind of stuff on this specific podcast, but from like a like resistance standpoint, your nose has more resistance than your mouth does. And so it's important for us to be able to breathe through our nose in order to like help our diaphragm contract strongly and be able to expand or depress fully, and then also being able to fully exhale. I think a lot of people that spend kind of their whole life in like this fight or flight, sort of like it's like an inhaled position, figuratively and literally. They have a really hard time getting that full exhale, which really helps you with getting that rib cage like as small as possible, which can help with waist control too.
So I I want to dig into how this affects positioning and loading of target muscles in training, because that was something once I was able to understand it, like that's all I saw is in my own training, but then in clients, I'm like, okay, like this is yet again an energy leak. We're limiting the amount of force production significantly through all these movements by being in. I love, like, it's such a dumb example, but I like using the example of like a slinky is like if you're pinching the like two sides on the same side, right, respectively, like you're going to have then that opening on the opposing side. Or even a dumber example is like a Pringle, is like you're making it nearly impossible to load not just the target muscle, but you're probably going to load secondary muscles that, in our case in bikini, it's like you want to grow your glutes, but you don't want your adductors and your hamstrings to grow nearly at the same rate. Yet a lot of these positions, we don't have that specificity, if we don't have that stability, inadvertently I've been training glutes this way and I've been getting stronger, but I don't know why they're not growing at the rate I'm intending them to. So I guess when we're talking about these positions that someone's in training, how do you like to cue not just breath work, but that because you described it, that 360-degree rib expansion, right?
Yeah. Yeah, so I think of the core, it's like everybody thinks of core as like abs, which it is. It is your abs, it's also your back, it's your pelvic floor, it's your diaphragm, but they're only going to work as well as you're able to also pressurize. So using your air, which isn't directly causing like tension, I guess, but the stiffness that ends up in your core because of that decreased volume. If everybody just listening to this podcast, extend your back like you're in your back pose, and then take a deep breath and tell me where you can either see or feel expansion. It's going to be your chest, right? You're probably not going to feel any expansion in the back, which is fine. It's a back post. That's like you're supposed to be in that position. It optimizes your angles, all that kind of stuff. That's great. But if you also do the opposite, so kind of like fold forward, almost like you're putting yourself into a cannonball, and then take an inhale, you'll feel you get a lot more expansion in the backside and not so much in the front. Both of those are extremes. It's like cat cow kind of. You want to be able to find that middle position in order to stack your spine in its neutral position, which is where it's like optimized for like loading the different segments, but also where you're able to get that pelvis neutral so that you can optimize the range of motion that your glutes are going through in like hinges and lunges and split squats, all that kind of stuff. If you're not able to consciously maintain that pressure and maintain that stability, then your pelvic stability, you're only as good as your pelvic stability. Like lower body movements are only as good as your pelvic stability, which is only as good as your ability to articulate and understand where the hell your rib cage is in space. And I think in bodybuilding, a lot of the poses have us more in this like chest lifted position, which is fine for like how it looks on stage. But when you're training, you do not want to train how you pose. And I think a lot of people maybe are stuck like that. At least that's like what I observe. And I'm sure you see a ton more people that are bodybuilding training than I do. But I would say a lot of people have a hard time like recognizing that the performance on stage is not the same as the performance in the gym. You do not want to be in the same position.
I love that you said that. Two really important just bars right there is like you're only as good as your pelvic stability, your ability to grow, your ability to load, but also, yeah, get out of your poses while you're training. Like that's not what we're trying to do. And I mean, like I've had people ask those same, they're like, well, I see this competitor, this influencer, the way she films all of her videos, like her butt looks like so big, like it's like super aesthetic. Like I want my glutes to look like hers. And then I go to said video or I pull it up and I'm like, yeah, I'm like, this is very much like it's eye candy. Like it's for Instagram, it's for the views. And she looks incredible. Don't get me wrong. I want my glutes to look like hers as well. But that's not what we need to do. We can appreciate it. We can appreciate the aesthetics of it. And I try to encourage people is like, know when we're looking at training videos online, know if this is just like it's an ego post. It's okay. I've made them. I've done, yeah, like I look great. Like my glutes are just on today. But also know when someone is trying to give educational content, if that's the perspective, if that's the angle that they're coming at it from, because my glutes do not look good when I'm in the right position. Like they don't, it's not that they don't look good. I shouldn't say that. They just like, they don't have that Instagram pop. You don't have that. Okay. Like we don't need that. We need to make the most of these sessions. And I think the one thing I want to go back to is the waist trainers, because you hit on that, and I just want to let you know, like out the gate, like I'm also of the belief that like in especially in training, I'm like that fine, you want to get waist control in bodybuilding, sure, but like in training, like that's one of those that just irks me. I'm like, we're not like, I've literally had clients tell me, they're like, my last coach told me like I'm trying to disjoint, I'm trying to separate my lower from my upper so that I don't grow my waist. So from your perspective, from your where you're at on the internet, what are your thoughts with waist trainers? What, I guess, if there's value, like, is that something that you can like justify or support? What are the drawbacks to having them in place, particularly in training?
Yeah, so I would say I'll give them like, if I was giving, like, a percent grade, I would give them, a like, a 10%. There is utility, maybe, but would you have the same effect if you just worked on waist control, like, worked on transverse abdominis control, worked on vacuums, just worked on being able to even, like, thoracic rotation and hip mobility when you're posing? Like, it's all an illusion. Like, people are not all as snatched as they look. It's really just your ability to know where you are on stage and, like, be able to, put the things that are, like, you want bigger closer to the judges and further away if they're smaller. But I would say for most people, I would not recommend them. And I think if you are going to use one, consider the fact that your core has a purpose. And like I said before, just like a couple minutes ago, like, you're only as good as your pelvic stability, and your ability to stabilize your pelvis and stabilize your core is, again, it's 50-50 muscle and pressure. And with a waist trainer, you really can't do either of those things. And again, anecdotally, I've also had clients tell me, like, they didn't even use she didn't even use a waist trainer for a whole prep, but her coach, waist trainers are a part of her coach's protocol, and so she wanted to, like, go all in, which is, I think, important when you're working with a coach. You should go all in. But she, like, feels like residual, like she has some bad habits that she developed, like with her pelvic floor and like her lower abs. She has a hard time connecting with those. Just because it does, essentially, it's like putting on a cast. It's like putting on a cast, which is the point, because it atrophies your waist, but you don't like you we have a lot of very important muscles in that region that need to be worked, and it's not like you're gonna necessarily get bulky. Like, I mean, I don't know. I really don't think that there's any, like, value that outweighs, like, all of the risks, and I just don't think they're really necessary. Also, like, they can cause problems, like, with digestion and things like that, which, again, I know people are willing to do a lot of things, make sacrifices for their sport, but I just don't think they're really necessary. I think you would benefit in many ways, not just waist control, through, like, just learning how to connect with your transverse abdominis and being able to work on your mobility.
I I want to bounce off from that, because like I was that person when I was like very much, hey, whatever it takes, like if I need to do things that I've never done before. And I subscribed to the corset waist trainers, like the hardcore ones where it was like we're wearing this as many hours of the days we're awake. Actually, for some reason, I did take it off during training because I'm like, I can't do anything with it this tight. Sure, like yeah, it definitely, when I had it on, like I mean, like my waist was in, but there were also points of the day where I could feel my waist falling asleep. Like I could feel the tingling, and there was a certain point where I was like, okay, there's got to be issues with this, just from a circulation standpoint. Like this has got to be posing some kind of risk. And I know most people, they're not wearing the corset style waist trainers, although that was very popular. I mean, 4 or 5 years ago. Now you have essentially the elastic bands that are like, I don't know, I don't even know. I mean, they're very much elastic, and then they're just kind of pulling you in place. But even then, the biggest change I saw, not necessarily in waist size, because I do have quite a small rib cage, but the biggest change I saw in abdominal control on stage was going all in on vacuums. And the funny thing is, like, I'm super a big fan of like free diving, and like I went through the certification, the level 1 certification a few years back. And I remember like static holds, breath holds, tables is a big thing in that community. And because of years of doing vacuums, probably incorrectly, but doing them without breath occurring, I mean, I was inadvertently very good at them. Vacuums in themselves, though, that helped so much in building that mind muscle connection and knowing like, okay, like I'm fully sucked in. Like it can't go further back than it is. So I guess going into the soft tissue work, because this is one thing like I noticed in my own training, especially with a lot of the flights lately, a lot of sitting at a computer or sitting on a plane, sitting in a car. I see the biggest difference in whether or not I'm able to not just connect to the glutes, but maintain that correct position. I see the biggest difference in whether or not I do that soft tissue work before training, specifically at the psoas.
Oh yeah. Yeah. Well, and with like waist control too, your psoas, it goes literally goes from your lumbar spine through your guts and then attaches to your hips. That's how it causes hip flexion. And if it's tight or if it's limited or if it's restricted, then it actually, I mean, it's pushing your guts out, right? And so you being able to like actually control your waist is that's not the only factor, obviously. But when it comes to like being able to control a hinge at your hips, like that muscle, I think it gets really overlooked. I also think a lot of people, soft tissue is great, but also they're teaching that muscle to work through full range of motion. Because just because we're sitting all the time and our psoas is tight doesn't mean that it's strong. And while of course I don't think many bodybuilders want to grow with their psoas, it does have a huge role in hip stability. Because any muscle, like when it's in closed chain, like it helps to balance the femur in the socket, just like all the other little muscles that are around the hip. Um, but one thing that I think a lot of people get confused is like I have people tell me that their hip flexors pinch when they're like squatting, or when they're doing like a Bulgarian or something like that. And I think it's the joint, not the hip. Like the muscles don't pinch generally, but that pinching sensation can be because you're like dumped anteriorly, which again, tight psoas or a psoas that's not good at lengthening fully can contribute to that. Yeah,
Yeah, I see that a lot on my non-dominant side, that non-dominant hip that really it despises internal rotation. And I mean, like, hey, like that's the top of the priority list when I go to train is I'm like, yeah, like MF, like we're gonna spend a lot of time here before we get into B stance RDLs. It's like we're really going to spend time not necessarily under working weight load, but we're going to hold that isometric to expose you to that. I mean, I almost like break it down. I'm like, all you're doing with these warm ups, because I know like you're also a fan of the 90-90 curl up, like you're just convincing your body that it's safe to be here. You're just signaling it's not as bad as for whatever reason you think it's going to be. Like you can do this, it's no weight at all, it's actually you're way stronger than this. And like I don't know, I love having that like almost like removed persona to your body. Like your nervous system is just all it's trying to do is protect you, and you just have to consistently, at intervals, especially with this kind of frequency of training the lower body, you just have to continue to let it know that like it's not unsafe for you to be here. Actually, we need to spend more time here instead of spending the same amount of time in these positions that you're already accustomed to.
totally. Yeah. When I think people, I mean, it can be hard when you're like just given like a general warm up, but like our priming movements before our training session, I would say are just as important as the actual like lifts themselves. Because if you can't get your nervous system right and you can't get yourself into a position to be able to actually load the joints through like a fuller range of motion with control, then I mean, it might be more fun to push heavy weights, and it is fun. Like I like to do it too, but I think like really spending the time to like, I mean, maybe you feel like an old person training, having to like warm up for 10 minutes or whatever, which is not even that long, but it really does pay off. And like you said, like the isometrics and just like familiarizing yourself with those positions, it pays off so much. And usually the things that we need to do are the things that we don't want to do a lot of the time.
I think we probably share similar philosophies with the warm-ups. I mean, it definitely sounds like it, but I mean, like I I'll do some of the soft tissue work to begin with, largely at the psoas, especially if there's been really long periods where I'm just in a static position. But the other ones I really like, and Jordan, this is directly from Jordan, is kind of working from the bottom up to create that stability of the pelvis. So a hamstring isometric, but like progressing that according to what I have in me that day. So there are days where like I'm fed, I'm rested, but I just got a lot of stress in and on my body. So it's like, yeah, dorsiflexed bilateral is very unstable today. But I use that kind of as a litmus. I'm like, okay, well, if the most I can handle. If that's already that first degree of instability, then that tells me like we shouldn't really send it the way we wanted to on B stance RDL, or maybe it's not in our best interest to do, you know, fives on a front squat. Maybe we should make it more of a skill day, because realistically, like what is that send it session even going to look like just because we want? I mean, but I really like the hamstring isometric. That's one that like I kind of like I give a lot of clients. I'm like, hey, like use this based on what you can tolerate that day, and we can make that same movement more unstable as we go. So I mean, I like to move Dorsey bilateral to Dorsey unilateral, then to plantar unilateral. And I mean, like you have this whole arsenal of ways to create or challenge that pelvic stability. And then that's not even getting into the degree of knee bend that you have, or whether or not you're truly like active at the glutes. So I like that one. The other one then he kind of turned me on to was an isometric lunge, but with your rib cage and pelvis like truly stacked between feet. And I know that like on days where just body weight, if I'm like good internal rotation with the back leg, if I'm like really stable, like at the torso, if I'm having any degree of challenge maintaining full foot pressure, if I'm noticing that front foot is shifting, what am I saying? Proximally to the outside, or if I know that back leg just like keeps like wanting to rise up or externally rotate, I'm like, cool. That's our answer for today. Today's going to be a skills day. As much as I wanted it to be a glute building day and like lift a bunch of weight, I'm probably going to be better not doing that. And I think that kind of maturity, I mean, like that's what I see resonating like in your content for me, is teaching the intricacies of knowing in that with those warm-ups that like you have all the information you need right here to make decisions about how that session should go, even if it's different than what was prescribed or you know you thought you were going to do on paper.
Yeah, well, and when it comes to like longevity and training and ultimately the results that you're looking for, like you can't just like lead with your ego every time. Like you really have to take how you're feeling that day and like push within the context of that. But again, like that maybe that's like what you said, like a skill day. Um coming like talking about like prep work, what I really think a lot of people in their training are missing is like frontal and transverse plane movements as prep work. And like, especially when it comes to the hips, like you want to be able to get into internal rotation. And sometimes the best way to do that before you actually do the movement, like a heavy movement, is like doing like a body weight movement. Like, are you familiar with like the DNS star? I'm sure Jordan, I'm sure Jordan is. He's a chiropractor. Yeah. It's like it's kind of like a side plank from your knee, but it's rotational. I can send you a video of it, but you're essentially your bottom hip is the working hip, and you're basically going to be on your elbow on your bottom knee, and then you're going to reach your opposite, so your top arm and your top leg away from each other. So you're kind of in like an almost, you're like in a sideways RDL hinge position, and then you're going to abduct that bottom knee into the ground as you extend through the hips. And that overcoming isometric against the ground is actually like such a great glute med activator. And also like glute max is going to get a nice stretch as you're like in that hinge position. But that's one of my favorite ones. Like I'll give that to some of the power lifters that I've worked with, and like these are people that can deadlift like 600 pounds, and they're like shaking because body weight and transverse plane stuff is not generally something that they really work on. But that's a really good one that I think probably a lot of your listeners would like benefit from as far as like prep work goes. And then like a Copenhagen plank also.
I so I know the exercise you're describing without the upper body maneuvering as well, but I do that one specifically like on my own, and I wouldn't even call it a good like glute med activator. I think that's what a lot of my clients think it is, and I'm like, no, like we're challenging multiple points here, but I'll just raise like that top knee and kind of extend it away from the body. But the idea is to maintain good pelvic stability, to not come extension, which is the position a lot of people want to be in. God, adductors are so weak. Like even just the thought of Copenhagen planks, it's like it's on my list of ones I need to expose myself to, especially with doing more bilateral movement, more bilateral squatting lately. But the 90-90 curl up is one I find for most people it is just so
So
humbling.
hard.
Yeah.
So humbling. Oh my God. The body weight stuff is always humbling, even for the people that can lift a ton of weight. But it's partially just like the motor control. that it takes, I think, just to like do multiple things at once, or like hold something stable while you move another point. But yeah,
Yeah,
I'm
the
so glad that yeah.
no, the B stance RDL is one that like I like it goes into every person's program. I'm like, we have to master this because it's going to expose you. It's going to tell me what bottlenecks you either have been ignoring, bottlenecks you know you don't know you have. And it's going to save us a lot of time in the long run because I mean, like we can keep putting you in this bilateral hinged position, but it doesn't really tell us where the deficiencies are. I mean, like, sure, some of them might be able to be seen, but I think like a B stance RDL, contralaterally loaded, a split squat, contralaterally loaded. I mean, those are two, especially like for individuals who feel like, I've maxed out my glute building potential, or, I think, the next progression is PEDs of some sort or more sets. I'm like, let's take a beat. We have some tools here and we have some things that even at very weight require so much coordination that like it's going to be frustrating, but like we're going to probably re-cue this for months before you really get the technique down. I don't want to keep you because I know you have probably a laundry list of your next part of your day. Megan, thank you so much for doing this. Thank you for being patient with my housework. This has been great. I station. I know listeners will as well. Um, I would love to refer people out to you because I think a lot of the times, I mean, like I refer out to Jordan oftentimes with his workload right now. That's getting a little tricky. But I know so many listeners, they want to work with a female practitioner. They want to work with someone who has been in the trenches themselves with these issues. Where can people find you? Where can they reach out to you for either one-time consultations or full-on coaching?
Yeah, thank you. I really appreciate that, and I appreciate you having me on. So the best place is probably Instagram right now. So my handle is doctor, like dr dot megsy dot dpt, and it might take me a little bit to get to you, but I always answer all my DMs. So that's the best place.
Amazing. Thank you so much for jumping on doing this. You guys, thank you for tuning in. Thank you for listening. As always, I will see you in the next one.